So I actually, even though people would call me a high-risk obstetrician, I actually don't like the terminology of high-risk pregnancy because I think it's too general and it doesn't really serve us that well. I think it's easier to talk about pregnancies that are at risk for certain outcomes and then tailor the management of that pregnancy to that specific risk that they have. That makes much more sense to me than just lumping everyone as high risk because of some different outcome or different risk factor that they have. For example, a very healthy woman who is 36 years old may be slightly at risk for having a baby with a chromosome abnormality. Well, we can address that risk by certain genetic tests or certain genetic screening. And at that point, once we have resolved that issue, she's actually not such a high-risk patient. Whereas a 18-year-old with type 1 diabetes with bad glucose control, she's going to be at risk for lots of various bad outcomes throughout the pregnancy, and it's going to require much more of a sustained and focused attention throughout the pregnancy.